I'm sorry. How do I stop this?
No, you're good.
Can you please make sure?
Yeah. No,
Hi, this is Dr. Khan, Executive Plastic Surgery. We're actually doing Instagram Live, YouTube Live, and also Facebook Live. So we just want to make sure the third phone is also connected. Everything good there? Okay. So I've just completed what is 100% total capsulectomy on the right and also on the left. This is a 50-year-old patient from the Midwest. Actually, she's been referred to me by Lori Clark. She's one of my patients. She's actually a practitioner up in the Midwest. She's basically helped this patient. And so she comes to me yesterday, and she and I have already had a phone consultation. She has had grade 4 contracture on the right and grade 4 contracture on the left, which means that she has the capsule is so hard and compressing the implant and certainly the chest soft tissues such that the chest is deformed. It's quote malpositioned implant and painful as well at the same time, and that's what basically gives it the grade 4, the highest of the capsular contractures. Not only on the right but also on the left. She's 50 years of age from the Midwest, and she comes to me with an exam that's concerning for potential rupture. So what I did was I did 100% total capsulectomy and Bloc on the right side. As you can see, I removed the scar that she had. This really helps with the aesthetic contouring. Now, as soon as I made the cut, I basically removed what was this green suture that you see. This is your Ethibond permanent suture. You can see it, and there's small, you can see the suture right here all along, and small pieces that I removed because I don't want to leave any foreign body behind. And you can see what appears to be scar tissue around the suture. I'm going to send this along with the specimen. Now, there was a lot of inflammation that she had, and as you can see right here, look at the shape of this implant. It looks more like, if I turn this around, more like a heart, if you will. And so this is how the implant was sitting, all the way elongated up to the clavicle. And this was the soft tissue, which was very much scarred. This is where the suture was found. I had to remove this one because this is that inflamed tissue. And so I removed the entire implant capsule, some areas relatively thin, some areas thick, and you can see how it forms a point. So what I'm going to do is I'm actually going to go in from here. I want to see what is in here. And I'll use my, so look at the scar tissue that's present. Just look at this scar tissue on the inside. So as I go in, now I'm going to go into the capsule very hard. There we go. So lo and behold, this is ruptured. And as I come out here, everything contained, let me move my scissor away. The ruptured implant to my, and remember I said this, the exam was concerning. Remember, majority of the times, it is, it's a silent rupture, right? So her grade 4 contracture and the pain she had on the right side, obviously the body is hurting. And you can see, look at the way it's disintegrated. And I'm going to go ahead, and this is the part where they write down what is the make or the model, and I cannot read what it says over here. But you can see completely disintegrated. This is from 2009. This is supposed to be, ladies and gentlemen, the safer, better gummy bear. I can drive my F-150 or my semi-truck over it. It's not going to rupture. Well, guess what? It is doing exactly that. And none of this spilled into the chest. Everything was contained. And as you can see, let's go ahead and have a look on the inside. I'm going to open this up. And you can see on the inside how all of this clearly could have spilled into the chest. I was not expecting the right side to be quite frank, but again, this is, you can still have a capsular contracture grade 4 and still have an intact implant like we have seen many times. So as you can see, look at this. This is bad. Now what you can do is you can actually focus over here, the Con procedure. This lady, nice lady, she's not going to get a lift. This is not the time to be doing a lift. She will likely, hopefully not even need a lift clinically the way she looks. It's hard to gauge right now. No drains. All the capsules are sent to pathology. Cultures are done for aerobic, anaerobic, and fungal. High definition pictures and videos are given to the patient if they want them. Twilight, deep sedation. To date, not a single patient has had any recollection of the surgery. I returned the implants to the patient, even this one in a bag. And then all patients get the same surgery regardless of age, health, comorbidities. Some patients, for example, they have had history of heart disease. I take those patients to the hospital. There are some patients I simply have said they have been so high risk I did not want to do their surgery. Now on the left side, as you can see, this is the excess skin that I removed. Again, what I saw, I changed my gloves here, and as you will see right here, this is that same Ethibond suture that I removed, and it was present along the lower part. Not a good idea to have permanent suture in the proximity of an implant, and so you can see how much it was tethered. Now as I was dissecting, you will see everything is done very well, but this is the part that was stuck. I want you to go ahead and appreciate, there's a small hole over here. This is the only one hole, and as I press over here, you see this hole again, very small hole right here. As I press, you're going to see that silicone come out, and another one right here. So this is the part that was stuck. Believe it or not, you know what this is right here? This is a piece of that cartilage. So the cartilage was going, and this was the dissection where I removed that perichondrium. That's the layer directly on top of the rib, and the periosteum. And this inevitably led to what is a break. So as you will see, I'm going to go inside. I cannot even go inside. That's how small this is. But you can see very small, like 1 millimeter and 1 millimeter here. So what I was able to do is I was able to take this and plug this, so none of it spilled out. And remember, you have to go in, and no need for drains. None of the silicone spilled into the chest, and everything was contained. And as you can see, everything is preserved. And as I go in right here, ruptured implant, and look at the way it is going to completely disintegrate. Again, no such thing as safe implants, and you can see how it has literally disintegrated. And implant from 2009. This is after the implants were introduced back into the market. So you can see how this tissue is. Now look at these patches of tissue right here around. The pathologist is going to review, look at this patch right here, this patch. The pathologist is going to review, CD30 analysis is going to be done. What I want to do is, I just want to take this tissue and I want to cut through it so that I can see. You can see, look at this suture material right here. See? Let me go ahead and show you. Literally, it blends in with the... Now I've lost it. Just a second, there it is. See, look at this suture material right here. Right here, the green suture, Ethibond. It's permanent. Orthopedic surgeons love it. It's very strong, rigid. So I'm just going to go ahead and cut this here. As you can imagine, how much was this lady hurting? I just want to see if I find any masses or anything that looks suspicious. Grossly, I like to always examine. But overall, everything contained. I'm going to avert this here. So look at this implant, ruptured. So this is my, so as you can see, no such thing as safe implants. Sealing implants cause the same hurt. Silicone implants certainly do. And the goal of the surgery is to do it in the en bloc fashion or 100% total capsulectomy. Everything has to be contained so that there's no need for drains. This is not the time, given the severe inflammation, especially in the grade 4 contracture, to be doing a lift. And she will, as you can imagine, only bounce back to a normal state of good health minus this pain, and we will see how she recovers from her silicone toxicity. You know, someone said, Well, I have a ruptured implant, and my plastic surgeon said I don't need to remove it because if it ain't broke, don't fix it. Technically, it is broke. It is causing silicone toxicity. It is leaching content. It's not meant to be in the body forever. This is probably one of the most absurd things that I've heard, leaving behind ruptured silicone implants. And the other point here is, do you want to wait for a rupture and then take out the implants? Because remember, they're not meant to be in the body forever, and that is another question, a philosophical question, where, you know, take care of a small fire versus a big fire. This is Dr. Khan, Executive Plastic Surgery.